So we're back for our afternoon sessions. And first up, we have Samuel Kim, who's going to talk about tobacco 21 laws that we mentioned a little earlier. So take it away, Sam.
Hello, everyone. My name is Samuel Kim. I am finishing up my graduate program at Charles Ardrey University of Medicine and Science, and it's an honor and privilege to be able to present today. And today, the title of my presentation is U.S. Tobacco 21 Law is a Public Health Victory. So here are the learning objectives we hope to achieve in these next 25 minutes. I'm going to summarize the tobacco and nicotine epidemic, explain the key points of the new federal Tobacco 21 law, and explain how this law is a public health victory and how it's going to potentially add to the combat of the both cigarette and vaping epidemic we're facing right now. So as mentioned earlier in the day, especially by the first presenter, cigarette smoking has been an epidemic for a while now. We actually have some of the same stats, but I think it's important to remember and to reiterate that 1 in 5 deaths every year is related to smoking and smoking related diseases. And I think it's very important that we understand that cigarette smoking is still rampant and it's still a very big issue. But another thing we need to remember is that youth smoking rates are still fairly high. So smoking rates are declining, with evidence coming out from the CDC and from the public health and from, on a state and local level. They are declining slowly, but there's a new increase in vaping. And so like my stat says, smoking has declined from 20.8% in 2005 to 13.7% in 2018. However, electronic cigarettes and vape pens, all types of products have increased insanely in the last 3 or 4 years. And so remember this stat. This is a very important stat that will come up later in the presentation. But in 2017 and 2018 alone, there was a 78% increase among high school students using e-cigarettes. And if you look at the other graph, you can see from 2016 to 2019, almost 20% increase in high school students and almost a 5-6% increase in middle school students using e-cigarette products. And this is the national rate. And so it's safe to say, or I guess it's not safe to say, but we can say with certainty that vaping is the new the new epidemic that's affecting our youth. So I'm not going to go too much into detail about vaping because my peer Jason right after me is going to give a lot more information and a lot more background, but I think it's just important to remember that these products are rampant and they're advertised as being safe and as a smoking cessation tool for cigarette smoking, but in reality it's quite the opposite, and you'll get to see that both in my presentation and in the following. So right now, there are 5 generations of e-cigs. There's the cig-alikes, vape pens, mechanical mods. The 4th generation is where we believe that vaping really took off with the invention of Juul and the mass production of Juul. And the most recent generation that's been released in the last year or so are these new disposable e-cigarettes called puff bars. So these are just some advertisements I was able to just pull off Google. It just shows you how easily these products are marketed, and they particularly are marketed toward the youth. And so we know that the youth are easily manipulated, both mentally, emotionally, and physically. And in a slide or two, I'll get into the more physiological effects of vaping. But it's important to remember that big tobacco companies, vaping companies, put a lot of money into advertisements and into ways to manipulate the youth to buy these products. And so if you look, that the one on the right, friends don't let friends buy cigarettes, but it's okay to buy vapes, or it's okay to buy e-cigs or Juuls for your friends. So currently the e-cigarette epidemic, it's associated with creating a new generation of smokers because it causes youth nicotine dependence. In studies both done by Dr. Friedman and our labs and collaborators, we've shown that levels of nicotine in e-cigarettes reach nicotine and cotinine levels that are substantially above combustible cigarettes. So that's, we know, as mentioned earlier, smoking itself is addicting, but nicotine is also the addictive substance in both vapes and cigarettes. So the US Centers of Disease and Control, like I mentioned earlier, reported a 78% increase, and the Monitoring the Future survey showed that vaping prevalence more than doubled in 12th, 10th, and 8th grades in the last 3 years. And in 2019, the prevalence of use during the previous 30 days was more than 1 in 4 students in the 12th grade. So e-cigarette usage is rampantly running amok in our youth, and especially middle school and high school kids. And up until recently, like I mentioned, anyone could get their hands on these products. They're really easy to get. They're online or even in stores. But this new law that we passed is definitely going to help stop this epidemic. So like I mentioned earlier, the youth are physiologically at risk for addiction, and that's why this new law, raising the age to 21, is going to be such a significant victory for us as we combat this epidemic. So the youth are especially susceptible to nicotine because physiologically their brains are vulnerable. If you look at the graphic here, youth are more sensitive to nicotine's rewarding effects, but they also display blunted withdrawal symptoms. So when you smoke nicotine or when you smoke a cigarette, nicotine binds to a receptor in your brain, and once it binds to that receptor, it releases dopamine, and dopamine is known as the pleasure molecule in our body. So when you smoke, you feel good, right? And then when you don't smoke, you have a craving, and it creates a cycle, you become addicted. But research done by the Odell group has shown that the youth are easily more addicted because of these physiological immaturity in their brains. And with the physiological immaturity, right, the prefrontal cortex is not necessarily developed, you're not mature. And so besides the physiological effects, mentally, you're not mature enough to make these good decisions, and you're more susceptible to making bad decisions, choosing to smoke, choosing to use vaping products. And so it's just a nasty, vicious cycle for youth. And that 17 to 21, that the late teen, early adulthood, that age group is very at risk for becoming addicted. And so this law is going to really affect kids getting their hands on these products and helping bring down the nicotine addicted generations numbers. So why is this so concerning? There's data out there that has shown that 95% of adult smokers claim that they began smoking before they turned 21 years of age. 75% of adult smokers said they first started smoking before they turned 18. So like I mentioned, the 18 to 21 is a very at-risk range for smoking. And if you look at that graphic, tobacco use is going down, but e-cigarette usage is going up again. So, there's this weird balance of, cigarette smoking is coming down, but e-cigarette usage is going up. But with the passage of this new law, we should start seeing the e-cigarette trend line also going down. I think it's just important to remember that e-cigarettes are a big problem, but this new law is definitely going to help. So this is my first poll question. So which of the following is false? 1 in 5 deaths a year are associated with smoking-related diseases. 1 in 4 high school students reported using an e-cig device in 2019. Cigarette smoking rates are decreasing, and 50% increase in youth vaping. So Norma, is there something in Zoom that I was supposed to do, or do I just move on?
Sam, we were supposed to plug in your, there it is. Never mind.
Okay. I'm looking at the chat. They say the poll isn't there. Well, I'll just move on. Hopefully we can figure it out after. I think there is something after. The false was the last one. It's not a 50% increase. It's actually a 78% increase in youth vaping over the last year. So 50% is right, but it's not technically the right rate because it's actually much higher. And so I'm going to be talking a little bit more about how California's Tobacco 21 law has directly affected smoking rates and vaping rates, or vaping rates in California specifically. And so California passed its own Tobacco 21 law in 2016. It raised the minimum legal sale age of tobacco products to 21 from 18. And so this is a huge victory in California in 2016. And I'm going to be showing quite a bit of data that has shown how significant this law was in California alone, and how we can compare those numbers and how we can compare that to the federal law that just got passed last year. So by 2019, so this number starts in, this graph shows 2002 to 2016, 2018. Oh, it got cut off. My apologies. But in 2018, only 2% of high school students reported smoking cigarettes, and from almost 10% in 2016. And so we see a drastic drop in cigarette usage in youth in California. In 2019, a study done by Zhang et al., they found that 63.6% of young adults aged 18 to 24 were aware of the law, and awareness was high across all ethnic groups. Over 60% of young adults surveyed agreed that raising the age of tobacco sales to 21 years of age would decrease youth tobacco use. And awareness of the law was at 98.6% among tobacco retail owners. 85.6% of those surveyed agreed that it was easy to comply with the law. Now, the law had a lot of, or before the passing of the law, there was a lot of opposition from big tobacco companies, the California Retailers Association, and a lot of it had to do with, obviously money involved, but a lot of retailers are saying, it's going to be hard to comply with this law. But the study done by Zhang et al. Showed, right, 85.6% of those surveyed said, there's no problem with complying with the law. So this graph shows where exactly our youth were getting their products. And so this graph done by the California Department of Public Health shows that in 2016, over 10% of shops were still selling to youth, and the youth were considered 16, 17-year-olds. So these were still under the age of 18, right? So this was still illegal, but over 10% of shops were still selling to them. By 2018, that rate dropped to only 5.4%. Now, that's a great drop, right? We see a huge decrease, but at the same time, it's still concerning that in 2018, even though the law had been passed for 2 years, there were still, some shops that were selling to youth, and especially young youth, not even, 18-year-olds, but these are 16, 17-year-olds. So underage sales, this graph shows underage sales to young adults among licensed tobacco retailers in California by retailer type. So we see most stores are, pretty much compliant except for the tobacco and vape shops. These numbers are still pretty high in those kinds of shops. 34.9% are still violating the law. That's almost 1 in 3 selling. However, these numbers are all lower than they were in 2016, so that's a victory. And 15 to 16-year-old youth have experienced a 45% reduction in the sales of tobacco products. So what's concerning with this is, although there are still some shops selling, it's slowly coming down. And I think, like I'll mention a little later, there are some steps that we all need to be taking to make sure that this law is being enforced. Obviously, the Department of Public Health, there's only so much they can do, and I think we need a lot more community activism to really help enforce this law. So youth tobacco use. So as I mentioned earlier, smoking is drastically lower. And if you look at this graphic, everything else is low. So cigars, cigarillos, cigarettes, hookah, smokeless tobacco, so like chewing tobacco, cigars, and cigarette, all those products are very low, especially among the youth. And this number has dropped, or these numbers continue to drop with the passage of the California 21 law. However, you see that graphic on the far left, electronic smoking devices, that number is still pretty high and will continue to be high for a little bit, I think, until we get some more policies that focus purely on e-cigarettes. So as we've mentioned, so California was probably one of the biggest states to do so, or the biggest state to pass its first 21 law, but we've seen evidences of how impactful a 21 law is going to be. So in 2014, New York City raised their age to 21. They've seen steady declines in adolescents' tobacco use since the passage of their law. In 2018, Oregon passed their own. Their data has shown significant decrease in tobacco use initiation among youth aged 13 to 17 and young adults 18 to 20. So again, at-risk age groups were smoking less, which is what we want with this law. In 2016, Hawaii passed their own law. They found average monthly cigarette sales dropped 4.4%. So in last year, in the end of the year in 2019, the federal government actually passed the legislation and changed the Federal Food, Drug, and Cosmetic Act, which raised the federal minimum age of sale of tobacco products from 18 to 21 years of age. Also, they included e-cigarette products with this law. And, this was a huge public health victory, but it happened, in 2019 or the end of 2019. So there was the whole impeachment process. And, this is right in the beginning of COVID, right? The COVID outbreak in China. And so this kind of took got brushed under the rug, and it's still continuing to be brushed under the rug, but it's very important to us, especially those invested and those involved in this process, that we really need to get this out there, and that this is going to really affect our public health, immediately in the next few years and for generations in the future. And so some benefits of what we believe are going to happen from the passage of the federal Tobacco 21 law is obviously a reduction in youth tobacco use, delaying the age when youth first start smoking, right? They're not going to get their hands on these products until they're 21. And at 21, we believe, you're still physiologically somewhat immature, but by 21, 22, you can make better decisions for yourself. The reduction of underage smoking in tobacco belt states, that's a huge issue. The tobacco belt states, and towards the Midwest and southeastern portion of our country, the tobacco is running rampant there still. Another benefit is the decreased underage attempts to buy tobacco products and an increase in the age gap between adolescents initiating tobacco use and those who can legally provide them with products, known as shoulder tapping, which is, you go into a store and you ask someone to, you hand them some cash or hand them some money and ask them to buy it for you. But obviously asking someone that's 18 versus 21, it's going to make a difference. Another benefit is reduction in the use of cigars, cigarillos, flavored products. Continuing on, there's a reduction in adult tobacco use and a decreased number of new smokers. A shift of blame from kids to retailers. And retailers will have to enforce the law at risk of penalization. Another benefit is we're going to see increased awareness of the risk of tobacco and e-cigarettes usage. We're going to see improved and stricter enforcement of the new U.S. Tobacco 21 law at all levels of government, including the military. Dr. Freeman mentioned earlier that vaping is rampant in the military, but the new federal law does make it illegal for those in the military and serving in the military to have to be 21 in order to buy the products. Before this, many of the states' laws that raised the age of 21, they excluded the military, but the federal law does include military and those members of the armed services. So anyone that's not 21 cannot buy cigarette or vaping products. And lastly, it's going to reduce smoking-related morbidity and mortality, hopefully bringing that 1 in 5 number, obsolete at some point, but we want that number, slowly we'll get there. So we estimate by 2026, we're going to see a 9.4% decline in adult smoking rates nationally. We're going to see healthier generations in the future, and hopefully a tobacco-free and nicotine-free America. And so comparing our estimates with the Institute of Medicine put out a very good survey and very good study of what they believe a federal 21 law would do. And they did this back in, I believe it was 2015 or 2016. So it was way before there was even a federal law being in the works of being processed and passed. So they projected a 12% decrease in tobacco product use among adults. And then they cite that a tobacco 21 law will reduce smoking by 25% among 15 to 17-year-olds and 50% among those 18 to 21. Or 18 to 20, sorry. These numbers are, I would expect to be much higher, since the law, is supposed to prevent these, youth from getting their hands on these products. But like I said, there's still shoulder tapping, and there's still ways to get these products, and there's a black market for these online. So I think these numbers should be higher, and I think we can make them higher, but this is what they predicted. They predicted that the new 21 law will prevent roughly 223,000 fewer premature deaths, 50,000 fewer deaths from lung cancer, and 4.2 million fewer lives of loss among people born between 2000 and 2019. So there are still some problems with U.S. Tobacco 21, as there's always going to be. We're still dealing with, youth addiction, especially with vaping. There's new products that are coming out. There's new products that, I just discovered a few weeks ago, and they're called heat not burn products. They're this new way of, obtaining nicotine through warming up tobacco leaves as opposed to combusting it. They're not too popular yet, but I feel like with some money and again in the right hands of advertisements, I think they have the potential of blowing up here in America. There's still problems with shoulder tapping, kids asking older kids or asking older siblings, things like that to get their products. There's a black market for these, and the online sales. And so this is what I think is probably one of the most concerning. Right now, you and I, we can go online and just, Google vapes, and there's going to be, hundreds of websites. You click one, and almost all of them just have that graphic where it just says, I am 21 years and agree to be verified. Or sometimes they just say, I am 21, I can enter the website. Juul is one of the first, I think, big companies that actually implements a age verification process. But on Puff Bar, which I mentioned earlier, is the new and upcoming product. You just click I'm 21 and they let you in. You have a credit card. You can buy as many as you want. They get shipped to your door in a few days. So as I finish up, these are some future steps you and I can take to make sure that the new federal 21 law, as we mentioned, it's going to be a public health victory, but it still needs, more mainstream media. It needs to be publicized. We need everyone to know about this, not just those invested in this field. And so things we can all be working are publicizing the positive effects. We can push for enforcement of the new law. We can push for taxation of e-cigarettes. We know that the taxation of cigarettes, back in time, really helped bring down cigarette sales. We can push for much tighter regulation of online sales. We can push for the ban of all flavored vaping products, and we can spread awareness of how dangerous tobacco products, including e-cigarettes, are. So as I finish up with my last slide, just want to bring in or tie this into the COVID-19 global pandemic. We do know that the SARS-CoV-2 virus infects lung cells through a specific receptor, and we've seen studies that show nicotine makes these receptors more available and makes them more abundant in lung cells. And we also know that smoking and vaping, causes you to be at risk for lung infections and at risk for pathogens in your lungs. And so, we also need to remember that the cigarette and vaping epidemic is, already rampant, but with another epidemic that can be adversely affected. We really need to get the word out that the 21 law is going to be very helpful for us and helpful for our future generations. And yeah, here are my acknowledged Dr. Friedman, my mentors at Drew, my peers, and everyone else at Drew. Thank you very much.